are on the couch with Helen Bevan, and we're going to talk to her about her sessions she did today. So, Helen, you spoke this morning about energy for change.
Yes, I think energy for change is such an important topic when it comes to seeking to create change in healthcare, because I think we have brilliant clinicians, we have a brilliant workforce, we have brilliant patients and consumers of healthcare, and we have such an opportunity to kind of ignite that energy to make positive things happen.
Yeah, and you talked about there were 5 different areas that you talked about that helped with the energy for change. Can you just explain those?
Yeah. So the work that we've been doing in England, it's identified 5 different energies that I think are really helpful when we're thinking about how we build energy for change. So the first one is social energy, which is about energy around relationships and connecting, and how we build a sense of us and us rather than us and them. And the second energy is spiritual. And what that's about, it's not religious spiritual, it's having a sense of a different future that we aspire towards and that we can all move towards. Then the third energy is psychological energy. And this is the energy where people feel they're in an environment where they feel safe to try out new things, to innovate, where they feel they trust their leaders, and it helps them to be resilient. And then the fourth energy is physical energy, which is the energy of implementation and action and making things happen. And then the last energy is intellectual energy. And intellectual energy is the energy around analysis and planning and logical ways forward. And the issue in the healthcare system, and we've had over 3,000 data points now that really back this up, is that too often our leaders over-focus on intellectual energy, on physical energy, and we under-focus on the social energy and the spiritual energy that we need, to make change happen.
Yeah, so some areas for us to think about. Yeah. The other session that you ran today was our design lab, which we've just finished. So can you explain how that works to our audience?
Yeah, so basically, my team in England, we work with a group in Sweden, in Jönköping, which is a little global centre for radical thinking. And between us, we've designed this 1-hour process. It's a design lab, and basically it's a structured process that people go through in an hour to design very creative outcomes to their problems, and starts off with people analysing each other's problems, and ends with people making a prototype big solution to the problem using a whole series of different materials. And I have to say that the GP community of the Royal College did spectacularly well, and just what incredible creativity there was in terms of some pretty big problems.
Yeah, and so there's a real buzz in the room, so thank you very much.
Oh,
it's been great having you here at the conference, and I hope you travel safely home.
Yeah, thank you.